Hello, my name is Tristan McMullen. I'm an eye surgeon specialising in surgery in and around the eye, particularly with eyelids and the face, and I do cosmetic work as well. And I've been asked to talk about the care following surgery, post-operative care. And I'm quite particular about this because I think it can affect the results, and particularly the speed of healing. And obviously, patients' expectations are high, and they want to get back to work or whatever it is. And the more you can accelerate that, the better. And on another, but more perhaps important point, one has to think about the safety of the surgery, and post-operative care is vital in this regard. I usually patch, or as in apply an eye patch to one eye. I have yet to apply it to both eyes, but I do warn patients that sometimes that might be an eventuality, so they could wake up after surgery with both eyes covered. But I usually cover whichever eye bruises more during surgery, because there's usually one eye that's a little bit more bruisey-oozy than the other. And I have this patch applied and taken off in the morning. And then I am very strict, probably a little bit too strict, about ice. I like patients to use ice 20 minutes of every waking hour, which is a very tall order, but it's very easy to spot the patients that do and the patients that don't follow this protocol. Patients that apply ice for the first 3 post-operative days usually look a lot better, a lot quicker. And after 3 days, I have them switch to hot compresses 15 minutes 3 times a day until the bruising goes, which is obviously a much easier regime to follow. But the ice can be either ice in a Ziploc bag with water, or perhaps easier still is just frozen peas wrapped up in a clean cloth, which can be applied. And you can have 2 bags of peas on the go, one in use and one in the freezer, and you can alternate those and use them every 20 minutes. As I say, it does make a big difference. With regard to care after surgery, I have patients keep their head above their heart. I ask them particularly to avoid heavy lifting or bending. So there's no point, as I had last week, operating on a patient who was proposing to move house. So he had the choice, move the operation or move house, so he's postponed his surgery. The rationale behind that is to prevent bruising and swelling or even bleeding behind the eyes, which is a dreaded complication. The sutures normally get removed at 5 to 7 days, and that's usually arranged in-house. And I have patients apply antibiotic ointment to the incision lines 3 times a day, and I usually ask them to do this for 2 weeks, by which time they shouldn't need any more. Patients often have dry eye following surgery for a limited period, and I have them use artificial tears by day on an as and when need basis, i.e. if their eyes are feeling a bit gritty and scratchy, I get them to use the drops. But most particularly and most important, I get them to use a preparation called Lacrolube at night, which I think should be used for approximately a month after surgery. Otherwise, it's rather patient depending. I usually advise patients they're going to be bruised for a week and swollen for 2, and the return to work rather depends on the nature of the work, whether it involves physical labour or heavy lifting, or whether it's BDU use, which can lead to dry eye. And so that's I usually discuss on a case-by-case basis. But if patients expect to be bruised for a week and swollen for 2, they usually find that that's a rather conservative estimate, and they usually, particularly if they use the ice, the swelling and bruising resolves much more quickly. But I give that as a sort of outside